One of the main things that you want to accomplish in your fellowship is coming out of it feeling comfortable with anything that would walk through your office door, no matter where you're practicing. And I truly do feel like you get that training here. You learn so many different techniques, you learn so many different ways of doing things, you can really handle it all.
Here at Mount Sinai, we're training the next generation of physicians to become leaders in delivering innovative healthcare across a woman's entire lifespan, advancing women's healthcare through education, patient care, and research.
It's an amazing honor and a privilege to be able to take care of women who have cancer. It's a huge life-altering part of their life, so you really have to have the passion for it. You have to love the patients. I think that's really it.
Leading the department's academic programs, I work closely with the residency and fellowship program directors and managers to provide a comprehensive training experience with extensive clinical and research opportunities offered to our trainees. The commitment of our department to medical education is clear, as illustrated by the department's educational achievements, including consistently being highly ranked among core clerkships at the Icahn School of Medicine at Mount Sinai, and frequently recognized with school-wide teaching awards.
We have a really good variety of every different type of gynecologic cancer. We see a ton of endometrial cancer. We see a lot of advanced stage ovarian cancer, unfortunately, and we do see a lot of young women with cervical cancer. We see advanced stage vulvar cancer. We really have a little bit of everything, which is important for training purposes. But I think from my training here, I can really say honestly that you learn here with really no fear. It's a very supportive learning environment.
Fellows training in gynecologic oncology at the Mount Sinai Hospital will experience a robust program that includes both inpatient and outpatient training. Our fellows take an active role in translational and clinical research, chemotherapy management, and our surgical service, in which we train our fellows to perform complex robotic, laparoscopic, and open surgical procedures.
The first year in our fellowship here is dedicated to research. So the first year fellow spends pretty much their entire year doing research.
We are part of the Tisch Cancer Institute, which has amazing research opportunities. We're one of the very foremost institutions in terms of immunotherapy, and I'm really excited to be able to offer our fellows that type of opportunity to work in a lab that is really groundbreaking.
The second and the third years are all clinical, so that's where we will be operating, we'll be seeing patients in the office, and primarily dealing with patient care.
One thing about Mount Sinai that really stands out is that we really offer the full breadth of surgical training. So I would say we're really 30% open laparoscopic and robotic surgery, which is really pretty unusual for a gynecologic oncology fellowship. So you will get trained in all three. You will be a master of all three. We have 8 hospitals. We take care of the largest market share of women with gynecologic cancers in the city. So you see everything.
There's a lot of sense when you first start fellowship that you need to impress everyone or not make mistakes, or you need to know how to do everything. But that's not the kind of program that we have here. Everybody is very supportive and understands it's a learning process. No matter where you start your process, you'll learn everything you need to know no matter where you're starting, and it goes by fast. So really enjoy every minute of it.
We are so very proud to be training the next generation of physicians and researchers to deliver cutting-edge patient care.
The Mount Sinai program was one of the original GYN Oncology fellowships when GYN Oncology started as a field more than 50 years ago. And I'm proud to be part of this institution, which is really an institution that changes how medicine's practiced.
The possibilities are endless of what you can accomplish here, and I think that's a big part of the draw.